Erectile dysfunction, ED, is something many men face at some point in their lives. Doctors define ED as the difficulty in getting or keeping an erection firm enough for sex. It might sound like a topic men avoid, but the truth is, it is very common. In fact, experts estimate that more than 30 million men in the world deal with ED at some point. There are many reasons why ED happens. Some are physical, like heart problems or diabetes. Others are mental, like stress or relationship worries. But one simple factor that often gets ignored is hydration, how much water you drink and how well your body stays hydrated. Your body is made up of about 60% water. Every system in your body, from your brain to your heart, depends on water to work properly. And yes, this includes your sexual health. When you're dehydrated, your whole body feels it, and as some experts like to joke, your penis definitely knows. This video will explain in detail how hydration affects erection health. We'll go step by step, covering blood flow, hormones, mood, dehydration symptoms, water goals, and expert tips on how to drink water the right way. We'll also look at other causes of ED, so you get the full picture. By the end, you'll understand why staying hydrated isn't just about avoiding thirst. It can also be a natural, powerful way to support sexual performance and confidence. The science behind erections. Why blood flow matters. To understand why hydration plays such a key role, we first need to understand how an erection works. An erection is basically a hydraulic event. Just like water pressure fills up a garden hose, blood pressure fills up the penis. The penis has two main chambers called the corpora cavernosa. When you are aroused, blood rushes into these chambers. As the chambers fill, the penis becomes firm and ready for sexual activity. Now here's the important part. Blood is mostly made of water. When your body has enough water, your blood flows easily, carrying oxygen and nutrients everywhere it needs to go. The heart pumps efficiently, and circulation is smooth. But when you are dehydrated, everything changes. The total amount of blood in your body decreases, leading to lower blood volume. At the same time, the lack of water makes your blood thicker, which slows down its movement. This reduced volume and slower flow restrict blood circulation, making it harder for blood to reach the penis. Since erections depend on strong blood pressure in the penile chambers, dehydration lowers this pressure, resulting in weaker and less firm erections. Think of it like this. If you try to water your garden with a half-empty hose, the flow will be weak and inconsistent. In the same way, if your body doesn't have enough water, the hydraulic system of your erection struggles. The role of angiotensin, a hidden factor. Science also shows that when you are dehydrated, your body releases a chemical called angiotensin 1. This enzyme turns into angiotensin 2, which makes blood vessels tighten and narrow. Narrowed blood vessels mean even less blood can flow into the penis. Some studies in animals even link high levels of angiotensin 2 to sexual dysfunction. So, while dehydration may not cause chronic ED all on its own, it clearly makes it harder for erections to happen. Hormones, stress, and sexual energy. Blood flow isn't the only piece of the puzzle. Hormones, your body's chemical messengers, also play a big role in sexual health. Testosterone and libido. The most important hormone for men's sexual health is testosterone. It affects sex drive, energy, muscle strength, and confidence. When you're well hydrated, your body runs smoothly, including hormone production. But when you're dehydrated, your body goes into survival mode. It focuses on keeping you alive by managing temperature, blood pressure, and circulation. Reproduction takes a back seat. Research shows that dehydration can raise cortisol, the main stress hormone. High cortisol levels usually lead to lower testosterone. Imagine a seesaw. When cortisol goes up, testosterone goes down. This hormonal imbalance reduces your sex drive and overall energy. Mood and mental state. Sexual performance is not only physical, it's also closely tied to your mental and emotional state. When you're dehydrated, it can trigger a range of issues such as anxiety, irritability, low energy, trouble focusing, and increased stress. All of these factors can interfere with mood, confidence, and overall sexual performance, making hydration just as important for the mind as it is for the body. Even mild dehydration can affect your mood. If you're tense, worried, or mentally drained, your brain may struggle to send the right signals to trigger an erection. Stress, nervousness, or performance anxiety can then make ED worse, creating a frustrating cycle. In short, drinking enough water not only helps your blood flow but also supports your hormones and your mental state, all of which are vital for sexual health. Recognizing dehydration. Many men underestimate how much water they actually need. By the time you feel thirsty, you are already mildly dehydrated. Mild dehydration often shows up through early warning signs such as a dry mouth or sticky saliva, fatigue or low energy, dizziness or lightheadedness, dark-colored urine, headaches, and even a reduced sex drive. These are your body's signals that it needs water before things get worse. Severe dehydration, on the other hand, is a medical emergency. It can cause confusion or difficulty concentrating, a rapid heartbeat, very low blood pressure, intense thirst with little or no ability to sweat, minimal or no urine output, and extreme fatigue. At this stage, immediate medical attention is crucial. If you or someone else experiences severe dehydration, medical help is needed right away. How much water do you really need? The right amount of water isn't the same for everyone. It depends on your size, your activity level, the climate you live in, and even your diet. General guidelines suggest that men should drink about 2.5 to 3 liters of water per day, which is roughly 10 to 12 glasses. The simplest way to check if you're hydrated is by looking at your urine. If it's pale yellow, you're well hydrated. If it's dark yellow, your body needs more water. However, if your urine is clear all the time, it may mean you're drinking too much, which can also put strain on your kidneys. Remember, hydration doesn't only come from water. Fruits, vegetables, soups, and teas also contribute. Foods like watermelon, cucumber, and oranges are excellent for hydration. Expert tips for drinking water the right way. Believe it or not, how you drink water can be just as important as how much you drink. Experts recommend sipping slowly throughout the day rather than gulping down a whole bottle at once, since your body absorbs water better in smaller amounts spread over time. It also helps to sit while drinking, as this relaxes your body, supports digestion, and improves circulation, including blood flow to the pelvic area. Another useful tip is to let small sips mix with saliva before swallowing, as saliva is alkaline and aids digestion. Choosing room temperature or slightly warm water is also better than cold water, which can shock your digestive system and force your body to work harder to warm it up. You should also avoid drinking too much before bed, since frequent bathroom trips can disrupt sleep, and poor sleep can lower testosterone levels, affecting sexual health. Finally, be mindful of when you drink around meals. Chugging water right after eating can dilute stomach acids and slow digestion, so it's best to wait at least 30 minutes after a meal. Can dehydration cause permanent ED? It's important to note that while dehydration can cause temporary erection difficulties, it usually doesn't cause long-term ED by itself. Chronic erectile dysfunction is often connected to underlying health and lifestyle factors. Common causes include diabetes, high blood pressure, heart disease, or poor circulation, all of which affect blood flow. Neurological disorders such as Parkinson's disease or stroke can also play a role by interfering with nerve signals. Lifestyle habits like smoking and heavy alcohol use increase the risk, while certain medications, including antidepressants and blood pressure drugs, may contribute as side effects. Mental health challenges such as anxiety, depression, or relationship stress are also strongly linked, showing that both physical and emotional well-being influence sexual health. If you experience ED frequently, hydration alone may not fix it. It's always wise to talk to a doctor to rule out underlying conditions. Practical hydration plan for better sexual health. If you want to use hydration as a natural way to support erection health, a simple daily plan can make a big difference. Start your morning with a glass of room temperature water to wake up your metabolism and rehydrate after hours of sleep. Throughout the day, keep a reusable water bottle nearby and sip regularly to maintain steady hydration. Before and after exercise, drink extra water to replace fluids lost through sweat. Including water-rich fruits and vegetables in your meals also helps boost hydration naturally. And finally, keep an eye on your urine color as your body's own hydration meter. Pale yellow means you're on track, while darker shades signal the need for more water. Within days of improving hydration, many men notice more energy, better mood, and sometimes even stronger sexual performance. Lifestyle choices that support erections. Hydration is just one piece of the puzzle, but sexual health improves most when it's combined with other healthy habits. Regular exercise helps boost circulation and supports testosterone levels, while a balanced diet rich in fruits, vegetables, whole grains, and lean proteins keeps your blood vessels healthy. Quality sleep is equally important, since testosterone is mainly produced during deep rest. Limiting alcohol and quitting smoking can also make a big difference, as both harm blood vessels and weaken erectile performance. Managing stress through meditation, yoga, or therapy lowers cortisol and helps improve libido. When proper hydration is paired with these lifestyle choices, the results are often stronger, more noticeable, and longer lasting. Conclusion: erectile dysfunction can feel discouraging, but it is not something men should ignore or be ashamed of. While serious medical conditions can cause ED, one of the simplest and often overlooked factors is hydration. Water supports healthy blood flow, hormone balance, and mental clarity, all of which are necessary for strong sexual performance. Staying hydrated is not a cure-all, but it's a powerful, natural, and easy step that every man can take to improve not just sexual health, but overall well-being. So the next time you reach for a glass of water, remember, you're not only quenching your thirst, you might also be supporting your confidence, your energy, and your sex life.